What do we do about treating a frozen shoulder? Well, first of all, it's going to depend on what stage you're treating the shoulder in. If you're in the freezing stage where there's pain and a lack of range of motion, then the first step is going to generally be to remove the inflammation and the pain. There are several approaches that you can use to accomplish this. Depending on the degree of pain, physical therapy is a typical first step. Physical therapy will generally include several modalities depending on the amount of pain, inflammation, and the degree of lack of range of motion. Stretches, both passive and active, as well as some strengthening exercises will be used. The therapist may use ultrasound, electrical stimulation, and other passive modalities to help with the inflammation. If physical therapy is not making sufficient gains, and particularly if the pain is limiting the ability of the patient to participate with the therapy exercises, then sometimes a steroid injection can be helpful. But this is going to really depend on if there seems to be an underlying impingement syndrome or rotator cuff tendonitis, in which case an ultrasound-guided injection to this area can be very effective to reduce the underlying inflammation. If there's underlying osteoarthritis or possibly a labral tear in the lining of the shoulder joint, then an intra-articular shoulder steroid injection, again being performed under ultrasound guidance, or this can actually be also done under fluoroscopic or X-ray guidance, can be very effective. If a steroid injection is used, then of course it's important to use the steroid injection as a way to reduce the inflammation that will then enable the person to return to physical therapy in order to more fully participate with the therapeutic exercises. Some doctors will also block the suprascapular nerve that innervates the shoulder. The suprascapular nerve is a peripheral nerve that can be blocked under ultrasound guidance. It's not clear exactly how the suprascapular nerve block works as well as it does, but for example, a 2022 study in the Journal of Clinical Shoulder and Elbow found that a suprascapular nerve block along with physiotherapy worked better than an intra-articular shoulder injection along with physiotherapy, and better than physiotherapy alone in treating frozen shoulders.